just looking through Plan 8 block rector sheet block on ARiRA. It's a nice little brief summary to start with to give you an idea of what the block's used for. So I'm looking at the clinical indications now. So midline abdominal surgery, umbilical, paraumbilical surgeries, cesarean section. This is quite useful actually, especially when you're planning to do lists, seeing what kind of regional technique you can use as well. So that can complete the step at the bottom of the screen, and it saves the steps that I've completed with a little tick box as well, so I can see where I've already reviewed if I want to come back to it in the future, which is nice. So I'm just moving on to patient positioning now. So you can bring up a nice diagram of how to position your probe as well. Let's talk about the relevant surface anatomy. Again, we've got a nice diagram similar to the one before, but overlaid with the relevant surface anatomy now, where you put in your probe what structures can help to identify the correct placement. Then moving on to the 3D internal anatomy. So looking at the different muscle layers. So here we've got a 3D anatomy model. So you've got 360 exploration. So as you can see here on the screen, you can drag this little cursor at the bottom and it's got nice little descriptions and labels for each of the muscle layers. For example, you might see a different aspect relevant to this block. And cadaver glide view, okay. So we have this little box that we can drag up and down here, and it either removes or inserts labels, again, for the important structures that you might need to know about this type of block. It's quite nice, it's something you can also just test your knowledge on before you reveal the answers. So you completely eliminate all the answers and as you slowly raise it up, you'll see it starts label thing, which is good. It's a nice little revision aid as well. Something that I'm not really seeing on many other regional technique manuals or books. And this is the sono-anatomy glide view, which I actually quite like as well. So it gives you a bit of a description about what it should look like. And as you can see here, you've got an ultrasound imager on the left, there's no labels, so you can drag that away. And as you move the cursor over, you can see that it again highlights the relevant structures, the way that the needle should aim for. Which is really helpful actually. This tabs for probe selection, so it tells you what kind of probe you should select for this type of block, what settings to have, the depth, the gain, focus, all things nice to help learn how to do this type of block as well. And again, this is just an augmented reality way of how to position your probe. Gives you some more landmarks, some optimization maneuvers. And you can alter the position of the patient on the screen to see how you should be placing your probe. Again, that's a really nice little touch. Zooming in and out as well. You can click on the little augmented reality button on the top, then you can use your own phone camera and aim it around the room so the patient can be in front of you in the room. Again, that's a really nice little extra touch. So what this is the, you can see where if you slide your probe along, it actually gives you a view of how that would change the image. So you can see here, on my video now, you can drag your slider along and the probe is moving along as well with a moving image of what you would see on the ultrasound. And again, that's really nice because we don't always get it right first time when we use ultrasound probes. So knowing what we're looking at different positions is really helpful as well. So here I can change what I'm seeing on the left hand side, as you can see. And here's the ultrasound probe. I can move it at different parts. And you can see as I move the probe on the right hand side of the screen, the corresponding image changes on the left, which again is a really handy little extra tool that you can use to imagine performing the block and doing the block yourself. This little green bar as well can help you adjust your view and what layers you can see on the image here. So surface anatomy going down in deeper structures. Okay, you can adjust that to the level that you need for your revision purposes. Change again on the image as well, brightness. That's really helpful actually. That's something I've not seen on other regional block teaching platforms. And this is all about needle insertion technique as well. Obviously, that's probably one of the really important parts of any kind of regional anaesthetic technique, and visualising your needle properly, the direction, the path, where you're aiming your needle to go. And this talks about all of those things here. Again, we've got a 3D model here that you can also click on the augmented reality to use your phone for. And you can adjust on the screen here, looking at the positioning of the needle, the angle, where the probe's being held as well. So, looking at the successful distribution of local anaesthetic, this is the next one. So we're talking about the spreading in the fascial plane, separation of muscle and sheath, the way you're looking for it to spread essentially to increase your risk of your chance of a successful block. Here's a list of some precautions and complications. Like anything that we do, there's always some kind of complication that could occur. This is just nicely organised in a way that's really easy and simple to read. What's nice about this as well is, with the complications that can occur, it gives you a brief summary of how you can manage those complications as well, which is nice. Again, that's not something I've seen in a lot of other regional block teaching platforms. You can see that I've ticked through all the different sections now, except that block. Gone through everything, should be able to read everything, and if I was in a different block, for example, it tells me where I've left off, where I need to continue from, so it's all very handy, and you can just go back to look at it at any point as well, which is really helpful.